Are you suffering with pelvic pain or pain down there or pain with intimacy and you don't know what to do about it? Maybe this has been going on for a short period of time. Maybe it's been going on for years. If you're looking for tips for your pelvic pain, then you are in the right place today. I'm Dr. Amy with Physical Therapy for Everybody, and here we see so many women who are struggling with pelvic pain, either just on a general daily basis or specifically when they're having sex. And we want to make sure that everybody can enjoy every aspect of their life pain-free, because that is really important, and that's an important part of life. A lot of women don't want to talk about this. In fact, even when they come into my clinic, they don't want to talk about it initially. They'll talk about their incontinence issues, they'll talk about their abdominal issues, they'll talk about the activities that they can't do, but they don't want to talk about this one. And even amongst our friends, we don't want to talk about it. We don't want to admit that we're having pain with intimacy or even pain down there that keeps us from doing the things we want to do. So we're trying to break through that silence, break through that myth that there's nothing that can be done, and get you some real answers into your hands today for things that you can do. You ready? Here we go. Tip number one, and this may sound counterintuitive, so please listen all the way through, but I need you to get moving. Movement allows that pelvic floor to move correctly, and it's a muscle. Every tissue in your body is designed to be able to heal itself as long as it's moving correctly. So activities such as walking or swimming can help get those hips moving, which causes a passive contraction and relaxation to the pelvic floor, which can significantly reduce your pain, because if the muscle's not so tight, chances are good that the pain is going to decrease. Now, the thing is, something like running is really high intensity on that pelvic floor, and it may be too much. You would know it was too much if you were experiencing pain either with running or immediately after running. If you can go for a 5-mile run or whatever distance you do, and that doesn't bring on your pelvic pain, you only have it, let's say, with intimacy, then running is probably not a problem for you, and you don't necessarily need to keep it out of your schedule. However, if you notice that you do have pelvic pain with higher level activities such as running or high intensity workouts, or you have it right after, it's probably over stressful for your pelvic floor. I would recommend stepping back from that, doing lower intensity exercises such as walking or swimming to help that pelvic floor be able to heal so that the pain will go away. Now, what if your pelvic pain is so bad that you literally cannot walk? Then tip number 2 is for you. If you are not able to actively use those muscles because your pelvic pain is so bad, and now with this, I want to be really clear, I'm talking about pain that is either in between your legs or on the front of your abdominal cavity. Okay, if you have pelvic pain that is more in the back over that SI joint, this tip is not for you. Okay, friends, it's very important because this is a tip I usually do not recommend, but it can be very helpful for pelvic pain specifically, but only if it's between your legs or in the front of your abdominal cavity. What you can do then is you can use heat. I usually recommend a warm bath because that's just the easiest way to get heat to that area. If that's not possible, you can use something like a hot pack or something like that. But you only want to do it for about 10 to 15 minutes. The reason why is that we do want to increase blood flow to this area because blood flow brings all of those healing cells, which is fantastic, but we don't want to bring too much because if you're not able to walk or swim or do some kind of activity, it's hard to get the muscles to be able to contract and release that blood because we want the good blood to come in, but we want the other blood to leave so that the area cleans out, right? So we need to make sure that we're not over-engorging that area and causing a stagnation. That's why we don't want to have heat for too long. That's also why I don't usually recommend heat because it can cause that stagnation in that area, which decreases blood flow and actually can lead to scar tissue formation, which is not what we want. But if you need some heat right now because you're not able to walk or swim or do something more active, it's an okay Band-Aid to apply for a short period of time until you're able to do that active exercise. All right, tip number 3. We need to strengthen our deep abdominals. It is so important to make sure that our abdominals as well as our low back are working correctly to take stress off of the pelvic floor. The abdominals, the low back, and the pelvic floor make a triangle that helps to really support our entire core. And it is super important to make sure that everybody is working correctly, because if one is not working correctly, the other two are going to have more stress on them. This is particularly true if you have pelvic pain and low back pain. Chances are really good that your abdominals have just tapped out and they're not supporting your core the way they should. This is going to cause a lot of stress, and until you deal with that abdominal issue, the pain is not going to relieve. Now, you need to start with very, very gentle exercises, and you need to make sure that when you're doing them, you're only using your abdominals. Many women I've worked with who have pelvic floor dysfunction actually use their pelvic floor when they're trying to use their abdominals, or use their pelvic floor instead of their abdominals. So why is their pelvic floor tight? Because they use it instead of their abdominals, and the abdominals are much bigger, so they have much more power. Don't try to substitute them with your pelvic floor. It will not go well for you. So if you suffer with pelvic pain, I definitely encourage you to work on some deep abdominal exercises that will help to relieve that pain and get you feeling better. Tip number 4, you need to stretch your hips. It is really important to make sure that your hips are moving correctly to take stress off of your pelvic floor. The reason why is that the pelvic floor attaches into the deep hip internal and external rotators. So internal rotators are toes coming towards each other. External rotators are toes going away from each other. It's really important that these muscles are in proper condition to take stress off of the pelvic floor, because that allows the pelvic floor to then contract and relax, which is what we want. We don't want the pelvic floor to constantly be contracted. That's not going to feel good. That's going to lead to pain. That's going to lead to tension. That's going to lead to difficulties and imbalances and all kinds of other things. So we want to make sure that the pelvic floor can contract and relax. And in order to do that, we need to make sure that the hips are moving correctly. So we need to stretch our hips. Plus, ladies, our hips are wider than our knees. So what tends to happen is that we tend to get a lot of hip stress as we're trying to keep our bodies moving forward. So even if you used to stretch your hips before and you've gotten away from it, I encourage you to get back to it. Stretching your hips at least 3 to 4 days a week will significantly help to decrease the tension in your pelvic floor. All right, so my last tip to decrease pelvic pain, again, is not going to sound very intuitive. So I need you to stick with me again all the way till the end here. You need to do the right exercises for your pelvic floor to decrease your pelvic pain. If you have pelvic pain, inherently, that means your pelvic floor is tight, because muscles are dumb. All they can do is contract and relax. Whenever our body, our brain perceives any pain, it's going to cause those muscles to contract, because literally that's all they're capable of doing, which means if you have pain, you have tight muscles. But if you do Kegel exercises and you already have tight muscles, they're not going to work because the muscles are already tight. What are they supposed to do? So you need to do the right exercises, which means an exercise that is able to cause a passive contraction as well as relaxation of that pelvic floor. Now we have an exercise like that in our guide. We're going to link the ebook below. I highly recommend that you download it. It has instructions on how to do the exercise. You can do it at home. I promise you can do it at home. You're going to do 2 sets of 15 twice a day for 30 days. Now, as you're doing this exercise, it should not cause you any pain. Most women do not have pain when they're doing it correctly. If you do by chance have pain when you try this exercise, then I need you to stop. You should not be doing any exercise that reproduces your pain. That is not helpful, because remember what I said, muscles are dumb. If you're causing pain, it's causing those muscles to tighten up, which is exactly the opposite of what we're trying to do here. So I don't believe that this exercise will cause you any pain or discomfort when you're doing it, but caveat, if it does, then I need you to stop, because you should not be doing anything that increases pain to your body. it should make you feel better. Afterwards, you should actually feel like there's a little bit less pain. But I'm okay if it's neutral. If you feel the same before and after, I'm okay with that. I'm hoping you'll feel better, but you definitely should not feel worse while you're doing it or afterwards. If you do, this is not the right exercise for you. And if that happens, I want to make sure that you find a really good manual physical therapist who is trained in pelvic floor physical therapy to help you specifically, because this is an exercise that should be helpful. So when it's not, that means you have something more advanced going on. We want to make sure you get the help specifically for your body. Now, what questions do you have for me? Drop your comments below. We love making videos to answer your questions and would be happy to make one specifically for you. And check out this video over here. We'd love for you to click subscribe. Have a great day, everyone.